So the first question there, a patient with acute bacterial pneumonia develops localized swelling and protein-rich fluid accumulation in the alveolar. Which vascular mechanism, so vascular mechanism is primarily responsible for this process? So like we mentioned, that's going to be the histamine causing endothelial cell contraction, thereby increasing intercellular gap between them, and that will allow those exudate fluid to be able to move into the tissue. Very good. Next question, which mediator is responsible for immediate but short-lived increase in vascular permeability during acute inflammation? So like I mentioned earlier, this is going to be our histamine, guys. Next, during acute inflammation, slowing blood flow causes leukocytes to move towards the vessel wall. This phenomenon is known as, remember, that's what we call what? Margination, right? So that's when the neutrophil is moving to the periphery. So that's what we call margination. Next, which cytokines are most important for endothelial activation and increased expression of adhesion molecule during acute inflammation? Remember, these are our acute phase cytokine, particularly interleukin-1 and TNF-α. Remember, those interleukin are also responsible for what? Particularly interleukin-1 is responsible for fever, whereby our TNF-α normally mediates what? Shock. Next, a 6-year-old girl has recurrent bacterial infection, and then look at there's absence of pus, so there's no pus, even though despite the bacterial infection, there's no pus at the site of the infection. And when we do our labs, there is a persistent neutrophilia. So this tells me that there's a problem with what? This patient likely have what? Leukocyte adhesion deficiency. So which step of leukocyte extravasation is most likely defective? So down to the what? Firm adhesion. So this is a problem with adhesion deficiency. Remember, there are two of them. We have the adhesion deficiency type 2, which is due to defect in what? S-Lewis. And we also have type 1, which is problem with integrin. Very good. Next, a neutrophil exits a post-capillary venous by squeezing between the endothelial cell. Which molecule primarily responsible for this process? Remember, that molecule is what? Our PERCAM1, which is CD31. And this is present on both the endothelial cell and the leukocyte. Very good. Next one, which mediator is most important for directing leukocyte to the sites of tissue injury after they exit the blood vessel? So they're asking us about what? Our neutrophil chemotaxis, guys. So remember, C5a, LTB4, interleukin 8, kallikrein, platelet activating factor, and M-methyl, right, peptide. So the best answer there will be what? Will be interleukin 8, which is D. Next one, in acute inflammation, leukocytes primarily exit the circulation at which location, right? Remember, we said post-capillary venules. That's where they go to exit. Next question, a 2-week-old newborn is evaluated for inflammation of the umbilical cord, which is omphalitis. The umbilical stump has not yet separated. The infant has a history of recurrent skin infections with Staphylococcus aureus, but no purulent discharge is noted. Lab study review markedly elevated neutrophil counts. Which of the following cellular defect is most likely cause this condition? So delay in separation of umbilical cord or inflammation of the umbilical cord with recurrent staph infection. And now we've seen there's no pus at the site of the infection, and we see a lot of increase in neutrophil in the circulation. So we see neutrophilia. So this is most likely what? Problem with integrin, guys, on the leukocyte. So the best answer there would be what? C. So this patient likely have leukocyte adhesion deficiency. And the last question there, which laboratory finding is most characteristic of leukocyte adhesion deficiency type 1? So like we mentioned, they're not going to have marginating pools of neutrophil. All their neutrophil are going to be what? Circulating, and that will lead to what? Neutrophilia. Thank you guys for watching. Please don't forget to like, subscribe, and follow us on our social media platform.